No, de nada.
¿Vos estás conectado también?
Yo ahora me conecto.
Ah.
Hola, muy buenos días.
Good morning, everyone. We are ready to begin. First of all, I would like to warmly welcome the ILO and CISS authorities, as well as the general audience who is following this remote mission to follow the ILO on protection and launching for Latin America and the Caribbean. In this case, it is a big honor for us as CISS to participate or to coordinate activities with ILO. Just very briefly, I want to share with you, for those who don't know, the CIS and ILO have a very close relationship since 1996 with the antecedents of the constitution for this conference. Both institutions work for the well-being in the American region and the Caribbean. So there were dialogues on the importance of acknowledging mandatory social security for citizens, and nearly 85 years later, and joined today, the ILO has proposals to expand social protection. Social security in the world is actually a challenge. Data states that in Latin America and the Caribbean, we have a long way to go to guarantee broader social security. But in order to be efficient and optimal with challenges in their expansion, we need tools, digital tools that are unique, with very accurate information with relevant data on the reality of the social security in countries. So, on that context, world data and ILO are very timely as a tool, as a very important tool that will work for studies in social security for institutions of different levels, for national institutions in regards with social security, and for the decision making process in every country. It is important to have key interest um, indicators that are encompassed for social security as a human right. Facing the emerging need for routes and strategies towards the resilience of our countries, from CISS, we hope that the ILO boards are optimally welcome as efficient tools for institutions in Latin America and the Caribbean. Without a doubt, the boards will enhance the national systems to follow up and evaluate social security, which will also input for an optimal follow up at an international level. We are also not doubting that it will have a great input on the Sustainable Development Goals for 2020, and especially on the critical situation we are living caused by the COVID-19 pandemic. So I want to reiterate the honor that we have a collaboration with the boards from CISS, and I hope that we all have a very profitable day with this presentation. And welcome, ILO, for your presentation, for your very interesting presentation. So without a further ado, thank you very much, everyone who joined us today. So I'm sorry. I will give the floor now to Dr. Daisy Corrales, who is the chair of the Central American Studies in Social Security Center for Latin America and the Caribbean. Thank you very much. Good morning to the authorities joining us. Dr. Sara Rasavi, Director of Social Protection from the ILO, Vinicius Piñero, General Director for ILO in Latin America and the Caribbean, the Central American uh, Center for Studies in Social Security in Latin America. We want to welcome you for this event. We have now the choice of introducing the countries in Latin America and the Caribbean, the boards on data and the ILO. And it's important to get familiar with them, also with potential users of the system. I wanted to tell you that since 1940, the ILO has been gathering very important information through the Social Security survey, and the different entities have been developing data as well, and those who come from countries themselves. So there have been great efforts from the directions from the ILO. Uh, Led by Jaime Duran, whom we will have with the translation of this tool into Spanish in order to have access from the Americas. We're also having an effort to have a database in Portuguese. Why is that so important to have this information matter addressed? Well, in terms of data management, there has been a pause on this matter because even if we have used them, we can see very important progress in terms of financial issues and commercial issues and so on and so forth. So we have a system of data analysis and predictions, and it is important to be able to guarantee from countries, first of all, having a statistical record system that is very well established with information that is transparent and very timely, so that the policy generation to address the regional needs, the region of the Americas that has 67% of population with need of service lending. So we have been affected with the pandemic from the health to work environment with a great requirement of social services. So the demand for those who work in technical areas, we have had a series of very important challenges. Like I said, first of all, managing for the countries to have these statistics required in order to feed the databases. The second important part is to maintain those databases according to the current technologies and being able not just to know what is going on right now, but also to work on provisions for the decision-making process and the distribution and allocation of budgets for service lending, which is important for the 2030 agenda. And also, there is another situation that has to do with, as was well mentioned by Dr. Nuno, um, the right to service lending and service benefits or legal benefits. So according to that, what that gives us is to achieve human development in a way where we can exclude or eradicate exclusion. So we have different topics like women's rights, children's, elder people, and handicapped people. So in terms of coverage, we are still having a long way to go. And what I mean by that is that we have a pandemic where we have an uncertain future with the socioeconomical impact, and we need to fine tune it and know all the new big data tools and other systems that allow for us to make forecasts both for financial areas and also the different needs that each country has. So every country is a very different legislation, is a whole world in itself, and the policies and all of the precepts that are encompassed in social benefits that are different in terms of those variables. So we need to do a very intricate knitting where we can assemble a system where we have universality in terms of social security principles. So we are going to continue with the words of Dr. Shahar Rasavi, who is the Director of Social Protection from ILO. She has a bachelor's degree from the London School of Economics and Political Science and her master's and doctorate from the Oxford University. She was a chief of the research section from UN Women from 2013 to 2020, where she led the research of the iconic entity research. She provided technical support for negotiations between governments. She was the first promoter at the Research Center of Social Development, where she coordinated comparative studies for social policies, social protection, labor markets, and care economy. She is currently a head of the social protection sector in the ILO in Geneva, Switzerland. So, Dr. Asavi, thank you very much for joining us and for giving your input in this very important activity that will have a great impact in the Americas. Thank you very much.
Thank you very much, and greetings, colleagues and friends, from a very sunny afternoon in Geneva. I hope that you are all well and healthy, although we are all concerned about the news of the third wave that we know is coming to the region and creating a lot of misery and concern. In any case, let me begin by saying that it is a huge pleasure and honor
Quisiera decir que es un gran placer
of the ILO social protection data dashboards for Latin America and the Caribbean. The ILO, as you probably know and was already mentioned, has a decades-long track record of really leading on the work on social security issues, which has included both very authoritative research and policy advice in this area, as well as production of data. Now, I think it was in recognition of the role that the ILO has played in the area of social protection that in the context of the 2030 Agenda for Sustainable Development, the ILO was selected as the sole and only custodian agency for SDG indicator 1.3.1, which is on social protection. Now, this, of course, was and is an immense responsibility, which gives us really an opportunity to improve the production, the analysis, the dissemination, and the use of data on social protection. We know from very good research and evidence that having robust and timely data on social protection that is disaggregated by location, by sex, by ethnicity, age, and employment status can be absolutely critical for us to understand much better how social protection systems are working, which groups are being reached, and who is being left behind. I think these issues are critical for us to know in order to improve the formulation and design of social protection policies. So having the right data that is timely and robust is a very useful tool in the hands of policymakers at the national level who are concerned about improving their social protection systems. I should also add that having access to robust and timely data is also very important for our social partners, for employers' organizations, for workers' organizations and trade unions, and for civil society organizations, so that they can really look and track progress in what's happening at the national level in making the right to social security a reality for everyone. And so that when they see that the progress is not sufficient, that progress is too slow or very uneven, so they can really hold the decision makers to account. So that's, I think, the power of data and the importance of data on social protection in order to be able to allow both governments and other stakeholders to really push the agenda of making social protection a right, a universal right for everyone forward. But there are also many challenges that we need to overcome. I think the problem of fragmentation in social protection systems that I'm sure our esteemed regional director, Vinicius Pinheiro, will have much more to say about, is one important constraint, which is making it very difficult for countries to provide a consolidated set of statistics at the national level on social protection. In many developing countries beyond the Americas, beyond the Latin America and Caribbean region, the problem of having limited financial and limited human resource investments in producing and managing social protection statistics and databases is another problem that really poses as a barrier to progress in data production. Furthermore, lack of access to data and limited capacity of users to use the statistics in order to really inform policies is another constraint that stands in the way. I think the social protection dashboards that we're very proud to be launching today go some way toward making the social protection data more easily available to a variety of users, both policymakers, civil society actors, social partners, students, academics, researchers, and many others. I really want to congratulate ILO colleagues in the region who have been working on social protection for the enormous effort that they have put into supporting national data collection processes through the Social Security inquiry, and into finally being able to bring the project to fruition with the production of the regional data dashboards, which are also now available in Spanish. The World Social Protection Database and the dashboards is a project that we want to continue to manage hand in hand with the social security and social protection institutions in the region. In particular, we really want to focus not only on the collection and processing of data, but also on the development of national capacities, as I mentioned before, to create and manage national statistical systems for social protection. Now, in the hope of our continued institutional collaboration, I would really like to express a huge thanks to the Conferencia Interamericana de Seguridad Social and the Centro Interamericano de Estudios on Seguridad Social for joining forces with us and making this a reality. I would like to express my deep gratitude, especially to the director of CISS, Dr. Daisy Corrales, for agreeing to support this ILO launch and for all the excellent collaboration that she and her team have provided in coordinating and preparing this activity. In this regard, I would like to also give special thanks to Anna, to Guadalupe, and Luis, who I know worked very diligently with our colleagues Zemin and Ana Carolina to make this launch possible. And if you allow me, I would also like to use this opportunity to really appreciate the vision, the hard work, and the innovative approach that my colleague Fabio Duran always brings to the work that we do in the Social Protection Department. So thank you very much and look forward to the rest of this launch.
Gracias, doctora Rosavi, por su participación.
Thank you, Dr. Rosavi, for your participation. Let's continue with Vinicius Cavallo Pinheiro participation. He is an economist and has a master's science of political science from the Brazilian University. He also studied in John F. Kennedy University in Harvard and in the Entrepreneurs Institute. He was a professor in the economy in the University of Brazil, and he has been written many articles on social protection. He is a special representation, a representative of the ILO before the United Nations until 2009. He was the head of the ILO in the management of the Agency 2030, and also he has been head in the multilateral agenda. He was a deputy manager in the ILO, and now he's a regional director for Caribbean and Americas, where he has a team of 9 coordination teams to respond to social impacts and the management of the pandemic of COVID-19. Dr. Cavallo Pinheiro, welcome. I give you the floor. Thank you very much. I convey my greetings to Dr. Mónica Núñez, and Director of CISS, and also Daisy Corrales, also from CISS, for this opportunity and this historical event. As Dr. Nuño mentioned, it comes from many years ago. So we have been friends in these Americas and the Caribbean region, and also Dr. Asabia and all the team members that were involved in this initiative. Thank you. In the ILO, we have had leadership and heads supporting governments and also the employers and employees in the assembly, management, design of social projects in the region. In the 50s, many of the systems came from post-war, and even in Central America and the Andean region, received support from the ILO. So social protection and social studies will continue to be one of the main working axes of ILO in the region from the 50s, and now especially fighting the pandemic. The social protection and especially social security have been the main axis in the response of pandemic COVID-19 situation. So congratulations to all my collaborators that have responded to the pandemic, designed new policies. So all those that intervene in that, you are heroes in order to soften the pandemic and to endure it. So thank you very much to all of you. Also, Daisy and Shara mentioned that our work is important, and the critical role of compiling data in social security and in the social structure to understand the design of policies in this regard is priceless. It's like a common asset. So I will give you a personal experience. When I was a director of Social Security and the Secretary of Social Security in the 90s, the information that was published in the journals about Social Security talk about frauds, that of course they existed, but also about the deficiencies and the long queues to receive social support. So when you refer to Social Security, you needed to go to the police news or the tragedies or the frauds. So it was a very negative image that was given to the system. Part of the effort that we receive in ILO to fight the frauds and deficit and long queues was softened by the collaboration we received in understanding the program. So in the GDP, we contribute even in 9 or 10%. Without the problem of how we are published, we will be able to provide more effort. So based on the support given to us to understand everything and to have better logistics and compile administrative data that many times are designed to provide information, well, we needed them to complete the management protocols and also compile data from surveys and budgets. So when we began crossing data, we realized that we were talking about the main pillars of the social stability of the country, of a program that is the main development resource, and that also help the management of the small and medium enterprises and shorten the gap of poverty and inequality. So we needed to design specific policies and also recognize that we were talking about one of the main pillars of the social stability of the country. So that has helped to revalue the social systems. And in fact, many of the programs of the 90s were impacted by this rhetoric of frauds on the deficit. And so we needed to restructure it, and we needed to put a new image to the system. On the other hand, when you begin to see backwards, you see that you have undergone many problems. But without the system, we will be having a critical situation nowadays of social explosion. So it was very important to have those information and to have data processes on administrative data, on budgets and sales and service that we conducted since the 90s. So that helped us a lot. And to all the citizens, because they receive a new vision of the social security in the period. And it was transparency also. And so, as Shahara said, we needed to continue to and to do what we needed to do and overcome the obstacles and that people see us with reliability. And also in the administrative processes, we needed to identify the concept because the flow of information was not designed to generate the information flow, but to manage the system. So we needed to see how many people with more than 80 years old were benefited. And we realized that we had more people than the population. And so we detected a fraud. No, and some other people said, no, there is no fraud, but the data didn't eliminate the people that died. So they over-excess the number of population because they didn't remove the people that were dying. Now it's easier. And also the combination of many areas, the unemployment, employment, retirement funds, health, that were managed by other ministries, we grouped them, and now we are receiving more budget. And in order to finish my presentation, I want to emphasize that that is important to fight the pandemic. Many countries right now are responding by better managing the information. And now that they have to face these, they have to redesign many things that, and also to elaborate things that didn't exist. And so that's why many countries didn't respond very quickly, because they were redesigning or designing for the first time systems for payment. And so in order, they needed to offset the social isolation of this pandemic. So now more than ever, the pandemic enlarge the cost of not having good information system. So I needed to congratulate for all the initiatives and all the input they have provided. And I want to tell you that all these people are feeding the information systems, and we need to give them also information resources. We want to tell them that we are now with these data dashboards. You are making a wonderful job in consolidating our administrative information, and together with other databases of surveys and census, we are able to provide different cross-information possibilities. And also, we see the new scenarios, as Daisy mentioned. We are facing the border of 2020 because many decisions taken today are based on events of the past, that were based on trends. And second, due to the surveys, we will improve the future. So the immediate response for having the information enable us to have new resources, and that is important for data social security. And so I also need to broaden my thoughts in order to incorporate big data in the analysis of social processes. So thank you, Daisy. I give you back the floor. Dr. Vinicius and Dr. Sahara Razavi, thank you for your presentations and orienting us on this topic. Now let's continue with the participation of Dr. Juan Diego Teran. He's one of our experts in statistics in the investigation area of CISS, and prepared the introduction to the topic because it's very important as a preliminary activity to know the role of the statistics and the role of statistics in the social security management systems. It is very important to have this structure in order to go deeper into the following points related to the world data dashboards for the ILO social security databases. Dr. Paez, he's an economist, graduated from Zacatecas University, graduated in population from the Colegio de Mexico. He's an associated researcher in the Center of Investigation of Economic Subjects and a professor in the Zacatecas Universities. He's a speaker in international arena, and also he has diploma in the market of the Mexico and United States, and he is an expert in the raising of information, coordination of field data, and the investigation of population data. He has an expert of the Inter-American expert of the senior people in the Institute of Social Security Studies. Thank you, Dr. Daisy, and good morning to everybody. As you have mentioned, I think we need to put the context on the role of statistics in the social security systems, especially for our region of Americas and the Caribbean and Latin America. I want to put you in context. When we manage or when we talk about the data that we have built, we need to put it in a context under the assumption that many things are behind. We need to recognize that the ILO since 2019 has been committed in establishing the concept of social protection inside of the Inter-American Conference of the Social Security and CISS since 1942. And also we have built a concept of social security. Each center has its own attributes and functionalities, but both try to benefit and provide the greatest happiness to the broadest population. In the context of all the meetings in the international arena, when we talk about the conditions of population in the world and is established in the 2030 agenda, the ILO has taken one of the tasks that are in the agenda and in the first target of 1.23, that is to improve the conditions, the living conditions of the population through social protection. Social protection is a human right. That is basics, in the sense that all the population, that all the people in this planet have the right to have a dignified life and have favorable conditions to conduct our life. The concept of social protection and social security are related in facing the social risks of societies, as for example, in the pandemic that we are undergoing. Due to all the effects that it can generate, we need to have strengthened systems and universal coverage in order to soften the effects. In that sense, we share the idea that social security is a universal concept and needs to be accessed by all the population and be benefited in the works. And not only in the works, by being human beings, we need to have this right. It's important that in the statistics and in the data dashboards that we are presenting today and in the countries of the region and all the countries in the world, it is necessary to interpret the data in order to understand the progress on social security in the last years. Among the objectives of the Sustainable Development and 2030 Agenda, it says that we need to reduce the gap in order that all the population have access security. And the only way to know it, if we are progressing, is evaluating certain indicators. The indicators of social security are very profitable at at long and short term. Many institutions in the international arena have predicted many numbers and see how beneficial will be investing in social security for improvement of quality of life and providing happiness to the population. Among the Sustainable Development Targets and the 2030 Agenda, this is an element to fight poverty, reduce inequalities, and to reduce hindrances for everybody being social protection. In Latin America, we all know that we have labor markets that are very informal, and social protection is an element that can help to approach everybody to formal markets. Therefore, social protection will conduce to social well-being and social protection, and we will be reducing the economic uncertainty. Part of the participation of who is responsible in building social protection structures with quality, well, we see that there are many stakeholders, the families, companies, and the states and the governments. So we have the idea that we need to recognize the social justice rights, solidarity, and peace. Unfortunately, data tell us that nowadays more than half of the world do not have social security. Therefore, one of our challenges in the 2030 Agenda are tasks in order to provide universal coverage on these concepts. Therefore, our own ILO statistics say that in 2019, if we invest 1.6% of the GDP of the countries in this concept, we will be able to close the gaps. We are in a world that living a lot of challenges and living the geographical demographics movement. And so the demographic aging is now more common in certain countries. Therefore, our social protection systems must provide the help to these challenges. Social protection is not static. As we have said since 2019, it is very popular. And the study of the International Center for the Protection of Labor have studied more. The societies change, and we also face different challenges according to our country's location. So we need to be prepared and respond to the challenges. One of the statistics of the work and demographics is to have these indicators in order to face the challenges at short and medium term. So we need to work to have more comfortable future scenarios. We have many challenges. We have a long age population, and we have the appearance of new chronic diseases, pandemics. Therefore, social protection is one of the pillars to protect the society. Also, from this idea, we need to provide solidarity and promote equity and equality and social protection systems. The policy of social security is not isolated, where just the states need to work isolated. No, and it has to be synchronized with other spheres or other pillars of the social development, the health, labor, economics, fiscal statistics need to be working in synchrony in order to improve living conditions of the population. If right now we ask ourselves, so what's the purpose of the statistics in social protection and social security? Well, it's important to have a hard data because it's a lot of work of ILO that ILO has put in all the data dashboards in order to share it with the countries. Because countries also need to have their own data, but we need to compare data and we need to shorten the time. That is a challenge. And also we need to provide more statistics disaggregated in different elements that may be geographics, demographics, characteristic of population in order to progress more in the provision of social protection. And that is an international demand. And also in statistics, we see a high value because with that, we evaluate if a public policy that has been implemented in the short, medium, and long term, we can see the effects and what we need to modify in order to go further. And in order to compare internationally, we know the actions of certain countries and that have been receiving tangible benefits from this implementation. So a good strategy is to see the actions done by these countries in order to replicate them in our countries in order to improve social security systems. Well, in a summary, we recommend that all the countries, once they have access to all this disaggregated information, it is good that all the countries can design new indicators, data collectors. I know that for many countries, to do a census imply a lot of effort and also a lot of monetary resources. The pandemic started in 2020 and prevented the conduction of census in the regions, but we can use instruments where we can compile information, where we can have reduced budgets, as for example, the surveys. I want to congratulate ILO because they have done a wonderful task in implementing an indicator that is to cover the target 1.3. And it will be presented by other speakers, and it will be very accessible, all the information to all the population and to all the heads and directors of social security systems, and that will enable us to provide more initiatives. It's a friendly, interactive software, friendly to users, and these dashboards are segregated by age, gender, and handicaps or disability. We have many challenges due to this COVID-19. It has moved our floor, but all the efforts that we have done has to be doubled in order to reach 2030 with all the forecasted scenario from all the countries. Thank you, Dr. Diego Teran, for your participation. I'm sure that you will be a frequent user of the data dashboards in the investigation projects of CISS. And yes, we will all be working with the information. Thank you very much. I want to tell you that many countries convey their greetings to the audience. And I want to tell you also that they greet all the participants from Guayaquil, Ecuador, and also greetings and congratulations to the different institutions. The head of Social Benefit Fund from Costa Rica, a Social Fund Ministry, and also they congratulate the work of the ILO and the role that we are performing. In order to continue with our activities, I have the pleasure to introduce Dr. Fabio Duran Valverde. Dr. Valverde, and I will give you a brief resume, has to be recognized because he has been one of the persons that has been dedicated all many years to social protection. As Dr. Sara said, Fabio gave to the systems an innovative idea and a creativity that enabled to develop many programs that, by the way, have been implemented in his research. I am pleased to introduce him. He is an economist in social protection. He has more than 36 years of working in social protection. He is a consultant of ILO, CEPAL, World Bank, the Inter-American Development Bank, Development Agency of the United Nations, and other international agencies covering Latin America, Caribbean, Africa, and Asia. He was head of the Auditing Department and Economy Department of Social Security in Costa Rica for 15 years. He's an expert in Social Security of ILO since 2005. He has written many articles on Social Security, health economy, auditing, and social expenditure. He is a member of the Spanish Organization of Health, and now he is the head of public financing, auditing, and statistics of the Social Protection Department of the ILO. Welcome, Fabio.
Muchas gracias, doctora Daisy Corrales.
Thank you very much, Daisy Corrales, and welcome and good morning to everybody, ladies and gentlemen, and thank you for being with us in this activity that is very, very important for us. Thank you also to all the colleagues of the CISS for all the support given to develop this activity and to launch this event together. I want to thank Dr. Corrales especially for her excellent work and the excellent work of her team and that she leads. I feel very pleased to be able to share this presentation of ILO data dashboards of Social Security and Social Protection. It's a great honor for me to participate in this period of time. I have also participated in the process. My colleagues and I am in charge of presenting the data dashboards. And I will refer to general aspects and will give some backgrounds of the project and will give a general overview of the work that we do in relation to data. As Dr. Duran has said, it implies a lot of work, very complicated work, but we are getting this complicated and tedious work, but with a lot of pleasure and a lot of commitment, and knowing that this is an important work and critical step to develop the system of social protection. I don't know if we can start. Yes, we have the first slide.
So as I said, I wanted to talk a little bit about this process and what we have been doing, and also how we see this project, the boards, how we are framing them in a bigger effort, work effort. And just real quick, telling you a different effort, as was said in 2016 when we had the challenge to produce a set of indicators for follow-ups on SDGs. In 2016, we defined and operationalized an GDS indicator. In 2017, sorry, we worked on the first completed or full report with the indicators developed in the department and the PFAC. In 2018, we worked on the redesign of the World Database for Social Provisions, and actually what we did was a redesign of the content and the scope, and also the whole technological renovation of the database and introducing modern tools for the management in this database. In 2019, we worked in data administration with the CISS, and actually this is important because we shared this data production work. And we actually managed to do this harmonization with Alice. And actually, we worked on automatizing a set of external connections, which we'll explain later. And then last year, during the pandemic and this year, we were very active producing these boards in a version in English and then working in a production of some versions of those boards. And we have a version for African countries, Portuguese-speaking countries, and in Eastern Africa. And this year we worked in other translations for the board in Spanish and with the boards into French and then Portuguese. So we are expanding efforts so that this data work is really accessible for millions or even billions of people in different languages. And we're on it, actually. We have a set of challenges, a very important set of challenges, as was mentioned. We think the biggest one that we need to face in terms of data is data fragmentation. There's this fragmentations of systems, and with that, we have data fragmentation. So in the Latin America and Caribbean region, we say that it is very developed, especially for data production, with very few exceptions, but practically every country is a good data producer, but maybe less producers of systematized and finished information, how to move from data to indicators of decision-making processes. So that is a challenge inside the countries. Of course, they are for us because it places us, or it imposes us the task of data collection and making those data coming from different sources and institutions in each country to place them in a joint platform and making them something harmonized and comparable internationally. So we think that there are other opportunities and challenges, such as the usage of these data in each country. And this digitalization in each country is pushing the development for these data production systems and statistics at a national level, and that's evidently creating a positive effect in terms of the work that we do with the gathering and production and systematizing of data. And I think the biggest challenge we will face for the upcoming years is to work with the countries and institutions into developing social protection statistical national information. We think that in as much as countries manage to develop these systems, we're going to be able to build more robust monitoring and evaluation, policy evaluation systems in a much more solid way. So now what I want to say is something more practical in a very general way, just explain how we have organized the data system in the departments. And I will give the floor to my colleague Silvia, who is going to explain that more into detail. So, telling you the more mature part that we are doing from the ILO is mainly focused in two areas in terms of data. One is bringing those from primary sources, and there we have some support and a very important participation with the ISS, and actually the work they've been doing in terms of data collection allows us to know the legal configuration of social security systems and social protection systems in the world. So they do that data gathering process, and we do the transformation. We transform the data production from them into data that is comparable to the ILO statistics. And parallel to that, the ILO, we have our own data collection system, more for the work market or the labor market, the ILO stat. It's statistics in labor markets and employment markets, employment statistics that come from different sources, and that's made by the statistical department in the ILO. And then the social protection department, which has a very developed instrument, and actually it has been working for years now, which is the National Security survey. And we gather primary source data from administrative systems in each country. So basically we take basic data on the inventories in programs and systems. We gather data on the benefits, the programs, and the detail for those, including the beneficiaries, the classification is different for each one, and actually we have details on the expenses and the incomes of those systems. These are the primary source data or internal sources that we use to feed the world database on social protection. And then we have sources that allow us to bring data from countries. So we have this tool that measures the impact in poverty, and we apply that in many countries. We have another tool that is big data, which is allowing us to monitor systems and the internet and bringing and collecting information in a more automatized way, such as tools of big data to know what is going on. So this tool allows us to know exactly, almost in real time with days apart, to know what is going on in the world, what are countries doing, governments doing, and what they want to do and what they're implementing. And then we have information that comes from national dialogue exercises with the DMD tool, something national based on evaluation. Then we also have a quantitative model systems. We have a posting system and we have a health system as well, so that with the data, we have other data which come from other sources in the countries. And then all that information is combined with external sources. So we have the Monetary Fund, the OECD, and ECLAC, the ECLAC equivalent in Asia, and other tools like the CISPA tool and the information from the World Bank, the Inter-American Development Bank, and the different surveys. We have a set of data, secondary data, that come from these external sources, and we have automatized reading systems that communicate with these databases, and it actually allows us to read those data and bring them to a data integration process, as we call it. So that's what we have. It's what we have here in yellow, right in the middle. And that's a work that we do with the data team, with our department, where we get all this information, we interact with the vendors, we interact with the countries in order to make all the cleaning, analysis, and data integration process, which allows for us to do this data harmonization that comes from the countries. Now, once the information for a region or the country is stored in the database, and then the next step is a set of tools that we developed over time to profit from the information that is already stored in the database. So what we are introducing and what my colleague Simi will be introducing is the data board. It has been recently created. It's been created for like a year or so in its first version. And we are now linking it in the Spanish version for Latin America and the Caribbean. So that is what we have. As we said, this is a very complex work, very hard work, and it requires permanent interaction with countries. It requires to solve endless minor tactical problems in order to sort out and manage to have a world robust, complete and harmonized database where every country is stated and where we have enough satisfaction levels with the content and the quality of that information. So I stop here and I give the floor to my colleague Simin, or I give the floor to Dr. Corral. I don't know. Thank you, Fabio, for introducing us to this platform from the ILO on social protection, which is one of the foundations for the whole region. So we're going to continue with our agenda with Ximin Yu from the ILO's social protection data analysis. He has a master's in development studies. He has worked since 2017 in the public finances unit in actuarial and the ILO departments in topics like the social protection systems, coordination of quantitative tools, and the technical and administrative support for projects, cooperation projects. He is currently a data official for the ILO. He will be continuing with the presentation of the World Data Board on social protection from ILO. Welcome, Siming. Thank you very much. Thank you very much, Dr. Daisy, and my colleagues, Xavi Duran and Shahara Razavi, for their input that has been greatly achieved here as of today. We have a partial result, and I will give you a guided tour for the World Boards on Social Protection. Just before that, I wanted to say that we have this focus on the World Database on Social Protection that my colleague Savi mentioned. And actually, as of today, the World Database has about 151 variables and indicators. I think we have more because we are continuously increasing and adding data from other agencies or internal data. So these pieces of data are at 3 levels, region and country. We have demographic data. Yeah, I wanted to interrupt. Can you, I'm going to show the, can you show the slides, please? Please share your screen. Thank you. Sorry. Yes, thank you.
Aquí. ¿Están conmigo?
Here, are you there with me? Yes. Yes, go on. Thank you very much. So the World Database on Social Protection, we have over 150 variables on, in 3 levels. We first have the regional and national levels, such as the demographical mortality and world market for work market, for example, informality, the macroeconomical, social protection, effective coverage, and so on. And these pieces are, as you said, as you saw on my colleague's presentation, it comes from different sources, internal, national, or international. And also through that survey, the Social Security survey, we have data at a program or a regimen level. Like metadata, depending on the program, what the administration is, if it's public or private, what are the program characteristics, what function covers, what coverage they have in terms of beneficiaries, and also in terms of expenses. How much is it spending with or without administrative costs? And then we can have several programs depending on the country, and under each program we have different benefits. For each benefit we have metadata, for example, the name per benefit, in English, French, Spanish, any language, the features and characteristics like age, the rates of contribution, the coverage data. At a benefit level, we have a program that could have different benefits, and we have the covered population. With the beneficiaries, we also have the expenses per benefit or service lending, and we also have the benefit with its level. And we have the database that covers the big regions in the ILO with Africa, America, Asia, and the Pacific, with Europe and Central Asia. And we are also going to open more for specific groups, such as the sub-regions, the different country groups, and so on. For now, we have PALOP, we have the African countries, and also some Eastern countries. We want to include every country that is interest, like ASEAN, BRICS, etc. So the dashboard could have different levels of analysis, and they are improved depending on the need, depending on our audience as well. And we cover 114 countries and territories. Lots of them already covered with that different data sources like the surveys or the different countries members on the ISS. And so we include and improve the coverage even with the data quality and data serviceability. We forecast that we will have an update for the following months, which includes more gender indicators and more charts to download formats from the CCB. And we have an update after the posting, the publication of the report, the World Report on Social Security. And as we are doing translations into different languages. And now I will give you a tour, a live tour. It's a guided tour to the dashboards. So we start with the cover. This is the one we built for the World Data Dashboard on Social Protection. And here we introduced social protection in different dashboards and a mini introductory cover that has different figures, such as the most important ones, like the latest report on the Social Security. We only have 45% of the population covered for by at least one benefit, or only 29% of the population is covered by an integral system in a country. And then also this information is just an example of the analysis that we were able to take from the world database, which is divided into different functions, like for the general population, for children, mothers with firstborns or with newborns, and those who are unemployed, for people with handicaps, severe handicaps, men and women, elder men and women, also in terms of health. And we have out of coverage, we have the data for the social protection expenses. This 2017 update, it's less than 11% of the GDP at a national level is dedicated for social protection, and another 11% for the coverage of population. And we expect to briefly be able to introduce you with the updated data on the World Report on Social Attention for the new edition. In terms of a data dashboard, I will give you a general panorama here of how it is introduced. It is a series of charts, interactive charts. And since it is interactive, we can just change the region from the Americas to the world. And we can see that with this change of filter, we have different regions with different results in real time. Here, for example, we have general information of the world, for example, total population, amount of children, our elder population, also the rates of population at the different processes. And then we have the coverage at a social protection, both for social protection in terms of a benefit, for social protection monetary benefit, or the affiliated population. So firstly, we have the coverage of social protection, and it's added in a 46.9%. And then the second one, which is 67.1% of the population, which is already ascribed to a regime of social protection. Now on the next chart, we have the effective coverage per function of social protection. And here we have the total population at a world level at 46.9%, and children at 26.4%. And we can see here that elder age has more coverage. This information is already updated with the new information, and 76.5% of the population above the retirement age, they receive a pension. And then in terms of lower coverage, unemployment, only 18.6% of unemployed workers receive or are compensated by an unemployment benefit. We also have the informations that have presented us with a map. We see the effective coverage of total population, and we also have a specific map for that, just to see that some parts of the world have that coverage better than 80% of the population. In some parts of the world, we have coverage. And say that here in Africa, most countries have less than 20% coverage. This map is also interactive, and you will see the change up next. And then out of effective coverage, we have legal coverage for per gender, and we have the working age population, and that's the denominator. And so we have that blue means legal coverage per contribution mandatory level. So in that type of regime, we see that nearly half of the population has legal coverage. That is, they are covered by law against the risk of aging. So we see as well that in terms of legal coverage, contribution is lower in unemployment. Only 27% of the population in working age are covered by an unemployment benefit. With legal coverage, we mean basically workers who are quoting by law into a social security regime. We can also convert the denominator into this. And actually, not every person is economically active, even if they are in working age. And we see the labor force, we see that the coverage rate is higher. So we see that 68% of the workforce at a world level is covered by a mandatory contribution regime. And you see that 8 or to almost 29% of the workers are covered and insured with a benefit for children and family. And we are also showing the different contribution voluntary regimes and the non-contributive. So the non-contributive regimes are more coded for the legal coverage, as is the case here. We can also see the public expense on social protection with a GDP percentage at a world level. It's not updated, of course, and this is, we have the 12.9% of the GDP at a world level is destined for social protection versus the almost 6% for health. And the second combination is that almost 20% of the GDP as an average in the world is destined for social protection. And then the last chart in this page, we have the development of the social protection programs per percentage of country. And here we can see that there is an evolution of how countries are starting to protect the population at different ranges. So we have, at the beginning of the 1900s, we didn't have many countries covering social protection in different areas. And by 2020, it is a very progressive ratio. By 2020, almost every country in the world, as we can see here, over 90 or 95% of the world is already covered by a program, social protection program. However, unemployment is still a challenge because only 52% of the world countries in the world have an unemployment protection program. And here we see that we can always change the region in the world back to the Americas.
Y ya la tasa de
And the coverage rate and the data, specifically also the MEBA, is more destined for the Americas. We can see that in the Americas, public expenses in social protection is above the world average. And the combination of expenses in social protection and health investment reaches 24%. But still in the Americas, only 32% of the countries have a pension program like that. So this is very useful to have a world panorama or regional panorama to go on social protection. And actually, we see that covered population is more relevant in the Americas compared with the world, which is 65.6%, who are covered by at least one benefit of social protection. If we want to know what countries specifically are covered by those systems, we just need to go to the dashboard at a country level.
se lo voy a presentar aquí.
I can introduce that here.
Here we have an example, Cabo Verde, the Green Cape. Well, the social protection status is presented in graphs that are similar. Here we begin with the National System of Social Protection to see which social protection branch in Cabo Verde has some legislation. We see that all are included in legislation. And we have a more detailed data, total population, children, senior people, different indicators, labor indicator, and demographics. So social economic indicators, human development index, Gini index, and per capita. This is the result of the combination of variables and indicators of different sources and different databases. The effective national coverage is here presented and also is presented based on the social protection index. And we can also go to another country. I think I can go to Mexico.
Un segundo aquí en mi
Okay, the timer is a little bit slower whenever I do a presentation. Sorry for that.
Un momento.
Just one more minute, please. Well, the presentation in my computer is very slow, but I think in yours will be faster. Okay, now it is responding. Let's go to Mexico.
Y aquí tenemos
And here we have the national social protection data and also the expenditure for Mexico. We see that all the branches are in the legislation, and also in terms of public budget for social protection, Mexico spends 7.5% of GDP. And also the updated ratification of the agreements with the ILO of Mexico, well, it has ratified 102 and 118 on maternity, labor risk, and disability, health attention, and migrants. Here we will have a very comprehensive table for almost all the countries of the world. Here we can also change and select the type of dashboard and turn it into maps. We see that the same indicators are presented here worldwide. Here, the effective coverage indicator, for example, total population, is here, and Europe and North America and in the Americas have a very good performance. And now let's go to the effective coverage of children. In this case, the Americas continues okay, but Africa and Asia have less performance. And in the rest of the countries have a coverage between 20 and 40% or less than 20%. And also we can say that many countries in Africa continue without data. Therefore, we still to do a lot of more effort. In relation to unemployment, we saw that the effective coverage worldwide is really wide in relation to other indicators as total population of children. And we can change the indicator to see effective coverage, expenditure, and expenditure for social security. We can also go to another country or region to see another approach. For example, in 2 countries of the Americas. As here, for example, and also let's go to aging coverage. As you can see, the table is very optimistic in relation to Brazil, Bolivia, Uruguay, Bolivia, and Argentina. They have a wide coverage. It's less, for example, for the Caribbean region. But if we compare it to the world, Americas show good performance in relation to the effective coverage of aging and seniority. We can go to another type of dashboard and put a grid. And here we see all the data, ratification of agreements presented in this format of grid. We can begin from Africa and the countries by region and sub-region. And the Central Africa or Septentrional Africa, and also in the same way we can see it in the Americas. And we can see in one frame the status of the updated ratification of ILO agreements in relation to social security in different branches. And the same data are in legal coverage.
Aquí.
And here, we have split it by function, and children, family, maternity, unemployment, risk, disableness, seniority, and here by gender, total number of women and men, and the program, mandatory, non-mandatory, and non-contributive. And also in the same data, we can see it in graphs for effective coverage. And here we see the dashboard presented like this in Brazil. And if we change to the Americas in the region, the dashboard responds quicker. And for the Americas, the total population protection is in a 65.6%. And we compare with the unemployment percentage of 17%. And here are the Americas countries where we have data and where we still do not have any data. Here we have Mexico, and it's protected nationally of 62.4% of total population that is protected with at least one area of the social protection. And also we can go to budgets. And here we can see the expenditure data nationally and regionally. For example, in the Americas, it spends 7.5% on health and 16.6% on social protection, excluding health. Data are updated and the sources are here. And they come from health, coming from WHO, from other sources of FMI, national agency or regional agencies. And lastly, we have the characteristics of the programs. Here, data come directly from ISS. Therefore, they are not yet translated into Spanish, but we think that it will be approved by December with the launching of social protection program. And the information, for example, the insure quote, the government insurance of the government and of freelance employers are here for all the countries of the world. We can choose one country in the Americas, and we can see that, for example, Costa Rica, the quote of the employer is 3.25%, and the legal retirement age is having a lot of details, and it's for 65 years old for women and men. This can be very useful because it is not only seniority and aging, but also all the rest of the functions. Going back to the dashboard globally, these are the data that we have available in Spanish in the data dashboards. And you can go to the system that I will share with you and visit the different branches. And also you can know more about us, the glossary, resources available, and how we compile data through the social security framework. Here we have links to other regions or to other group of countries in different dashboards. We have the Portuguese PALOP data dashboard, and also this dashboard is a main dashboard that we are thinking in translating into different languages. We can visit also other tools of the ILO. For example, monitor of social protection and response of social protection to COVID-19, the quick calculator of social protection for COVID-19, or ILO title for COVID-19 and the rest of the world. And at the bottom, we have notes with a brief explanation of how we calculate the effective coverage or indicators 1.3.1. Going back to our presentation, this was a tour to the data dashboards. And I will be pleased to receive your questions. I will give back the floor to Dr. Daisy. Your presentation was excellent. And I think you have guided us excellently through all the data contained in the worldwide dashboards in relation to social protection. The operation of the dashboards will be an exclusive work of all the people in the technical areas, but everything is very important for taking decision makers. And also they will be feeding with this data many regional studies. Based on this sample, collected in a very short time and presented in a very short time, the Americans showed a great fight to achieve the greater coverage of social protection. Therefore, in the following activity, we will exchange experiences in the Inter-American Center of Studies of Social Protection. And our primary source are the national experiences and the exchange of knowledge and the individual experiences and national experiences. Therefore, we have invited from the region of Argentina, the coordinator of integral analysis of social security, the CISS, and Dr. Alejandro Calabria, economist, has a master's in economy. I give you the floor, sir. Thank you very much, Daisy. Thank you. And thank you to everybody, ladies and gentlemen, for the invitation to participate in this forum. We are presenting a very useful tool as the data dashboards. And thank you, Yubo, for this guided tour. It was very enriching. And I can see that it will be a tool that we will be consulting permanently. I will begin with my presentation. And I will give you the apologies of Ignacio Lleno, that was the previous speaker of this presentation. But today in the morning, he had to go to certain appointments of Social Security entity, and he was appointed by the ministry to cover the pandemic. And so he is over there in another appointment. I will try to abide by the time that has been given to me, that is 7 minutes. And the objective of my presentation is to tell you how we build, how we use, how we put to the availability of the population all the statistics that we generate. And CISS is the National Agency of Social Security and is the entity that manages almost all the retirement funds in Argentina and the payment of different family contributions to parents, children, and adolescents, and different social benefits, for example, unemployment, scholarship for students. And so the scenario of activities is large, and it covers 17 million people and pays around 18 million the currency of Argentina every month. Well, in charge of many policies and covering so many people, it has a lot of databases and information sources. And so CISS is one of the bodies, if not the only body, that has the most robust databases in Argentina. So it has a lot of responsibility and manages this very useful tool. But we need to know how to use it. As the previous speakers have said, we need to update it permanently and put it into the availability of the general community and to the researching community and academicians, as well as to the policymakers, as Daisy was mentioning. And CISS, among all the fringe benefits that pays every month, accompanies the population throughout the life cycle, even from the pregnancy. And CISS is providing universal coverage of benefits for pregnancy and accompanies children and adolescents up to 18 years old with different benefits. And as from legal age or 18 years old, he gives a study scholarship. And as soon as they go to the labor field, it can cover eventualities, for example, unemployment, disability, and at the time of retirement, pays the retirement pension. And if the spouse dies, it pays the compensation and the contribution to the other spouse. So it accompanies the person from the birth to the death. That implies great responsibility, but also gives an excellent opportunity to build quantitative data and qualitative data of high quality that needs to be at the service of the community. In that sense, one of the main tools that we have in order to put this information to the availability of communities is open data. It's a tool in the ANSES webpage where we provide updated data and that we update every month, mainly on statistics of fringe benefits given by ANSES. But also, we give all the framework to the sustainable funds. That is the fund of money managed by ANSES to face certain major force events, where that implies to have sudden expenditures. And we provide information on the income and expenditure of the body, which are the amounts, which are the sources, and what is the result of everything expended. In the CISS webpage, we also have a platform that is the Social Security Observatory, where our main tool that links us with different bodies and the academic community receives periodically different investigation documents that we do based with all the statistics that I have mentioned. Last year, we were doing every 15 years some forums and discuss different topics, and with the participation of employees of the ICSS. They talk about their collaboration, which were their collaboration, and it was a very productive space, and I think we will be participating in that forum again. This tool is always available to the community. It is data that is not they're just open because they have confidential data, and they have also aggregated data. So before May, we hope to update the open data section and present these statistics in a more dynamic manner and be less delayed in the updating. We monthly update it, but usually we have a delay of 3 months, and we want to reduce it to 1 month of delay. When one builds these statistics and put it to the availability of the community, one needs to understand what do you want to do with the statistics. On our side, we understand that it's a very important tool to build investigation documents, but behind that, we link with other bodies and we are permanently working with them. But these statistics, we understand, are essential input for the design and the continuous improvement of public policies. In that sense, I want to give you a brief example that is very important. It's about a very important social fringe that is given by ANSES, and that is when the child is birthed, and also transfer money to all these children up to 18 years old or with more than 18 years old but with a certain disability. And they need to be children that are parents of that are coming from parents working on formally or in other private houses. And that policy covers 4.4 million children and adolescents. And by following up constantly all the statistics and surveying and going deeper into these, we always are linked with other bodies in the nation. For example, in this case, we link with RENAPER, that is the registry of people in the country, and we detected thousands of girls, boys, and adolescents that were written here to receive this allocation, but were not receiving it in fact. So there were some spaces there in blank, and that maybe subject it to law because they were not receiving the money registered. And maybe due to the lack of information, and if we completed it, we will be able to cover the coverage. And that was done with a decree issued in the last day of last year, the last day of December 2020, an allowance from January to include automatically more than 235,000 girls and adolescents, and also identified over 190,000 that with just a slight change in the norms and improvement of data that we have from them, and some cases with some territorial surveys were included in our policy. So at the end, all of them were included, and we are under the process of including those that are missing. And says, besides the benefits that gives by routine, due to the lot of flow of information that it has in its database, has to be the main stakeholder in designing and implementing many policies that are issued by emergency cases. In the case of a pandemic, well, that is something that occurs and one needs to respond continuously. Ignacio Mirandena, that was going to give this presentation, now is working in some policies that will be issued today. We have been working on them recently. And a very important benefit that was implemented at a record time and was perfected throughout the time and with the best use of the statistic was the IFE, that is the Emergency Expenditure Fund. That was a policy implemented last year due to the pandemic of COVID. And there was a monetary transfer of 8,892,000 families. And due to the compilation of many data sources, we were able to implement it quickly. And also we identified with that many people that were not updated in our database. So based on this, we improved the policy. And in the second payment of IFE, that was in July, and the third payment that was in the first weeks of August and beginning of December last year, we were able to improve the timing of the policy. We detected many people that didn't have banking accounts, or maybe have them, but they didn't want to use them or didn't know how to use them. So with that organization gap resolved, we compiled a lot of banking information. We informed the population and taught them about their use, and that made us include many people that didn't have a bank account or didn't know how to use them. We're now using them and reduce considerably the implementation time of the first payment of the second payment of IFE. The first one was in 2 months from June, the second from August and in 2 months, and the third as from August up to December. This will not be possible if we couldn't have analyzed all the statistics that we built. By interacting with different entities, for example, the Federal Organization Managing Public Incomes and the RENAPAP. And also I want to mention that the statistics are used as main tools to follow up all the management. So it is very important that these statistics be available continuously to all the policymakers, and as Daisy explained, and it is also very important to be very serious and that they be homogeneous and long-lasting and of high quality, and also have a friendly and fast access. If they are more graphic and dynamic in their information, it can be more useful. that tool, because many times people that need to take a decision are very short in time. And so they need to have that information in an agile manner. Therefore, the tool you are presenting of the dashboards, besides all the work that it implied in organizing, compiling databases, well, I can tell you that graphically, I can tell you that you have done an excellent work in its development. And the same, we want to do it with our statistics and present them in a friendly way, not only to the community, but to the people that need to take decisions. A few months ago, we sent reports to all the governors of the provinces and to the municipalities, the intendants of our country, with disaggregated information of all the people that are in our CISS database. And we think that in that way, we contribute to the link that needs to be among the different national and state agency to allocate policies that many times are federal policies, but that need to go to different areas of the country and with a very heterogeneous geography. By abiding by the time given to me, I just want to tell you that the statistics are reliable and long-lasting. They have high quality and can be used for academics, professors, students, and for policymakers in order to have more information at the time of taking decisions. Because we are convinced that if you do not measure and you cannot manage, you cannot do statistics. And so if we better manage and better measure, we can take better decisions. I appreciate your time and attention, and thank you for this tool, the valuable tool that you are giving us, because it will be a valuable consultation tool and will enable us to do better documents and do better policies and compare it with other countries of the region, and that will be nurturing all the system. I want to tell you from the Planning General Director of CISS, we are here at your availability in order to respond to all your questions. Thank you, Alejandro, for your participation, for your clear presentation of all the progress that it has had on CISS. We congratulate you. And of course, we will be contacting you after this forum, because we need to continue talking about social protection, social security. And now we have the participation of the National Board of Granada. And we have the Professor Master Lewis. He has a bachelor's degree in management studies, graduated from Indian Occidentales University. And in 1998, she joined to the General Studies of Social Security of Granada. She has been adscribed to the Planning Department and Statistics from 2006. Marcia is the head of the body of statistics, and in the 15 last years, she has been gaining experience in data compilation, analysis of data, and she has perfected her skills in computing and statistical technologies applied to social studies and the consultations on databases. So let's listen, Marcia. Welcome. I give you the floor.
Okay, good morning or good day to everyone, and thank you, Daisy. I would like to thank you all for having the NIS Grenada here to give our experience over the years in terms of how we manage our data, how we monitor and organize our data. I want to say I feel very excited and I welcome the idea of the data dashboard, and I know it will be very useful to the NIS Grenada. The NIS Grenada is a pension fund, and we offer other benefits such as sickness, maternity, and employment injury. And at the NIS Grenada, what we realized is the importance of data. And what we need to realize is that Social Security schemes do hold a wealth of data. So at the NIS Grenada, what we do, our database is the AS400. This is what we use to store our data. And our main tool that we use to analyze data is the Excel. So we would use the Excel, and over the years, we have built on our Excel skills in terms of developing macros to run our queries and bring down our data to Excel for us. We have padded our data with dummy data so that the macro can run it and update the tables on the information that we are monitoring. Now, on a month-to-month basis, we do some monitoring in terms of a report, and we capture information that happened for the month. And then at the end of the year, we have historic data. So by the beginning of January of the following year, what we try to do is try to update that historic data for the previous year. So we have historic data from National Insurance Scheme started back in 1983. So we have historic data from 1983 and right up to 2020. As of January, we would have done the update for 2020. So this is what we try to do annually. Now, as I say, we understand the importance of timely and accurate data. So the data that we do use, management normally uses this data to make decisions. We also have what we call some performance indicator that we monitor each month. So again, we use these performance indicators to make decisions and to know where we are, where we're going, and if we are on the right track. Now, the data that we have, we will have persons requesting data, but we are guided on how we distribute the data. So we do not distribute data in detail, but we aggregate the data. And we have requests for data over the years for things like number of pensioners in payment, things like the expenditure, new pensioners, how many pensioners may have exit or leave the no longer receiving pension. So those are the information that we provide normally. We also try to provide information internally in terms of, we keep a dashboard on some of the indicators. So internally, we monitor those information. Now, as I indicated, we guided on what we can provide to the public, okay? Some of the information that we get regular requests for, things like active contributors and those sort of information, we try to update this information every month so that in the case someone from the public requests that information, we can easily distribute that information to the people. Now, the monthly report that we do where we collect data tables on what happened during the month in terms of how many pensioners received payment, how many sickness benefit we paid, how many maternity benefit we paid. We also provide the Central Statistical Office with a copy of that monthly report as well. But over the years, what we've tried to do is develop a database of external information relative to other social security schemes in the Caribbean. So we wanted to do that so that we can have information that we can compare. But we did not keep that practice for long. We did it maybe for 1-2 years, and afterwards it just fell by the way and we never continued with it. Something that we've discussed over the years too is having certain data available on our website so that persons can easily access those data. We have discussed it, but we have never gotten around to actually doing it, okay? We normally have a lot of requests for data from persons who are doing studies, and even data that should be obtained from the Central Statistical Office. When they call the Central Statistical Office for those information, sometimes they refer them to the NIS. But sadly, we don't have that information. And as I indicated at the beginning, that Social Security organizations do hold a wealth of data. So we do encounter issues in terms of data that we want to get from the outside that are not readily available to us. Even sometimes in terms of doing our review, our actual review, information that we have to get, sometimes the statistical office does not even have that information. So these are some of the issues we encounter in terms of the information that we need. So with this dashboard, I'm hoping that we can access readily information. It will be helpful to us, and we can use those information going forward to make decision, and we can compare where we are, where we want to be, and where we're going. I appreciate your time, and I again thank you all for having this dashboard. Thank you.
Thank you very much, Marcia, for sharing your experience in Granada and also for sharing us your great experience with data management.
You're welcome.
We already know that a lot of that has been successful, like a universal or almost universal protection in many of those topics. For example, for children, Argentina, Brazil, Costa Rica, and Chile have a very good experience in the newborn baby moms. In Canada stand out. With elder people, we have Argentina, Bolivia, Canada, the US, Trinidad and Tobago. So I think in these topics, we've all had our experiences, and what we follow with like added values it stands out with those coverage. However, we need to continue thoroughly working. So now we're going to move to an important section, which is first communicating the greetings and congratulations that we received from the collectivity of those who are participating. Congratulations to Dr. Juan Diego Teran for the great summary. They also send greetings from the National Union of Workers in Mexico City. Thank you for your participation as well. We have total support from the Actuarial and Statistic Studies Center from the Superintendency and Labor Hazards in the Dominican Republic. And now I'm going to share with you a comment from them. We have congratulations and greetings from Ecuador and also from Panama, from the Social Security Board, and they also send greetings from the Superintendent's Office in Ecuador. So greetings and congratulations from the collective from the Elder Persons Live and Gender Equality in Peru. And I communicate these messages and congratulations and everything because the audience we have in Social Security is a brotherhood. We are all struggling and trying to seek and achieve well-being of peoples and their happiness, even if we are in complex situations. So we're now going to move on to read some questions and seek answers from the panelists. Also, I wanted to tell you that there have been some direct questions, especially about the platform management, which Simin, you already responded directly on the chat, but we have some others on the table. One is when will you launch the next world report on social protection with the foundation of these social protection boards? And we need to see the answer with the ILO colleagues. Mr. Fabio? Simin, I leave you to it. Yeah, same. About this question, we will be launching the next world report on the second half of this year. It's very likely that it will be at the same time launched in English, French, and Spanish, and we will have data synchronization between the version in the report and the world boards, so dashboard. So they will share the same data, and they would be the visual arm of our report. Thank you very much. And here from the Inter-American Conference in the direction for the international cooperation and linkage will be very willing to help you with that navigation. And also the next question is there any board on the view of the reforms that have been imposed lately, particularly the reforms implemented in the COVID-19 context? Well, I can get that. Maybe just to take turns. So yeah, the answer is yes. With this big data tool that we shared with you, which is called the Monitor for Social Protection, we have permanent monitoring of everything that governments or countries announce that they will do or are doing. So this is a daily monitoring. It's almost live. The dashboard updates are not live, but it does have that feature, so you can consult that. If maybe some of my colleagues can help me share the link to the board, to the dashboard, for the response or answers to COVID-19. For us, it has been a huge challenge since last year to be able to mount a dashboard, a specialized dashboard on COVID. It was possible thanks also to the work of data intelligence and introducing some intelligence AI tools, etc. And then we finally have that dashboard. We have two monitoring dashboards. One is the general, where we have general reforms. Any reform in any social protection system, which was published in any way, almost always is captured, regardless of the language it is written in. That is the general monitor. And then we have a specialized monitor, specialized in COVID, which is usually updated in, the last one was, if I recall correctly, a few weeks ago. I don't remember exactly the exact date, but it's very updated. Thank you very much. Now the next question follows along the same line. If ILO publishes a report or a technical detail with certain frequency that synthesizes the findings of the world dashboard, do you have that? Not the world dashboard. We are talking about two different things. We have the World Report on Social Protection that we post every 3 years. That's the publication cycle. Over those 3 years, we have a data collection cycle of 60 countries per year. That's our cycle. 60 every year we gather information in 60 countries, so that after 3 years with the next report, we have updated the databases for about 180 to 200 countries and territories. A little more sometimes, because some of the big countries have a big influence on data average, like China, in Latin American countries like Mexico and Brazil, we have a more frequent effort so that we can maintain added data as fresh as possible. So that's the data cycle for the world database on social protection. And then we have a data collection cycle that is daily. It's basically live with the social protection monitor. And what we see is what countries do. For example, the government announces that they're implementing an unemployment program. And so we immediately capture that. So we have a dashboard where we have that information. I don't know if maybe we can visualize that dashboard. Yes, of course. The social protection, the general one, social protection dashboard, just so we get an idea. Yes, of course. I can show the answers with the dashboard, especially for COVID. Yes, okay, so let's just give you a minute so that they can have an idea what we're talking about. Yes, yes, of course. So if you're looking at my screen here, I see the answer on the response to crisis of COVID-19 in the whole world. So we did this dashboard during the last year's contingency for COVID-19. We saw the last saturations, but also we closed this 2020 year where we closed 1,622 new pieces of news for all the territories. As you can see, the structure is similar to the data dashboard on social protection, but here you can see how new the news are. So we see what countries have a response to the social situation here in the map, and you can also visualize very easily that the answers had a boom over March and April. And almost every country in the world, in every region, already gave a response for COVID-19, and we also classified them. For example, we have most of the measures or the news are non-contributive, or equivalent to that, they're new programs or benefits that are not supported in existing structures, which of course varies from region to region. If I go to the Americas, this dashboard is also interactive.
Sí, voy a las Américas.
If I go to the Americas, we can see that we also have the measures for 45 countries, a total of 464 measures. And I think every territory answered with a social protection for COVID-19. Most of the measures, or the most frequent ones, are the benefits to special aids, followed by employment protection and nutrition, and then unemployment insurance. And then the types of measures we have, for example, the most common ones: introduction of benefits for vulnerable or poor populations. So we have 7 regions measured in the region. Also benefits for that are independent or self-dependent. We have 64 measures, and so on. We continue with basic services, coverage extensions, increase of level of benefit. And that's important because almost every measure is new. Nearly half of them are new, and they have a short duration. In the world, we have about 1,600 measures, and those out of those, 60 were long-term, so they're here to stay, and the others are not. They usually have a 3 to 6 months duration. Likewise, if we go and see a different panorama of the dashboard, we have the measures here. In the Americas, we started recording for the beginning of April, or about a year. Every measure per country, per type, per social protection function, if it's contributive or not, what type of action, a brief description, the date, and the original piece of news. where we captured the measure. Thank you, Sving. So you can consult that information at a country level because that's what they asked. Yes, we can do that at a country level. We have a full inventory. So the dashboards are supported with the full record, which can be downloaded by the users. And also we have a world data dashboard where most of the data can be downloaded. The indicators can be downloaded locally, which is also an advantage. Usually in the publication of the World Social Protection Report, everyone can download the charts and actually be able to use the information directly from the dashboards to the Excel. So I don't know if we want to move on to the next question. I think we don't have any other questions. So we have a comment. It's very interesting that could be about the process of conclusion for this very important activity. Dr. Leticia Martinez Martiñón, who is the director of the Actuarial Studies and Statistics for the CISS in the Dominican Republic, she sent us a comment where she first offers all of the audience members total support from the direction of the Actuarials and Statistical Study Center from the Superintendency of Health and labor risk is, and she says that the key to success is involvement from the person who is generating the information, the concept limitation, and also potentialization of that information. Availability and access need to consider all these elements in order to guarantee comparability. Dr. Martinez Martiñón is also a member of the CISS board of directors, and we thank her for her commitment here in the Inter-American Conference with the actuarial issues in the past few years. So thank you very much, Doctor, for your participation. And well, regarding what we can comment for our conclusions, as I said a few moments ago, we are a great brotherhood in the Americas and also at a world level where we seek well-being and the happiness of our populations and citizens through social or legal benefits. And we recognize Social Security as a human right, and we guarantee coverage to quality access. And it has been very tangible with the pandemic and after or in this post-pandemic period. And also with very sensitive issues like migration and other issues that are difficult to cover given the relationship there is between financing and the legislative part. It is important to note as well that in this moment we are going to work with less resources because we are walking towards an economic crisis, and also on the other hand with a higher need for social protection. So the balance is getting unbalanced actually. And so it has always been difficult and it was not adjusted because, as I said in the beginning, the need for requirements before the pandemic, they were 67% of the American population. And now with the current situation where we can add unemployment and a series of other social phenomena, we will have a higher challenge. So we're still missing a lot of work to do in order to guarantee social universal security. And we recognize or acknowledge that this is the vehicle to close gaps towards the 2030 agenda that we need to set on the table again and to review the strategies we had planned prior to the pandemic in order to comply them. It is essential to develop statistical systems collaborating with the countries for social protection systems. And here it is very important to highlight the role of the services in central protection in the users and how these users should be indicated to have an active participation in the system. The user should also have awareness of the usage of these requirements for social protection. And for us, even if we curate all of the data sources to be able to select the people who have the need to be addressed with social protection systems, we also need transparency and honesty from the populations, for which reason it is very important to have this very essential training stage and the statistic tools and systems. As we said, nobody can control what we don't know. And you cannot create policies on the unknown. So dashboards are a useful tool for country access and to know where we are headed towards. And that's actually one of the most important tasks with the type of protection we've seen that can be done. And here it is important to acknowledge also the quality of health equipment or health teams. And at this point, it is very important to have data access, but also training for their processing and also to carry out every projection. From the Inter-American Conference on Social Security, we are at your service, and we will do whatever it takes to promote Social Security towards this path of universality, although we are in difficult times when the history will value the effort we can carry out daily on a daily basis. Thank you very much for your participation, everyone. Thank you, Dr. Fabio Duran. I don't know if you're available for a closing remarks, and then we would be finalizing this event. Mr. Fabio? Well, thank you very much. We are over the edge of our meeting. I want to thank you for your participation. We are very thankful for the CISS for this space and the help that you've given to organize this activity. We have the commitment to continue working. This is a work. Those of us who work with statistics, it's very hard to work with data and building data at a world level that are harmonized and comparable. And we maintain institutional commitment to continue working on these lines to improve the content quality for the database and to continue having it available in Spanish and the different languages, because it used to only be or mostly be in English, and we're working on it. We are committed with that. We continue with the fight, and actually we want to enhance our relationship with institutions and seeing how all that data collection that we do can be much more coordinated. We hope to continue working with you in the future, more closely together. So we are at your service, and thank you very much. Just a comment. Well, in order to have, if you need any feedback or for technical support, you can directly contact us with the email, software data at ILO.org. And I wanted to also thank all our colleagues who supported us with the revisions. We have Amanda Moraes here with us. She's our consultant. Yeah, thank you. Thank you for thanking our colleagues and reminding us of them. Thank you. Well, that was very important. So we want to say goodbye to our participants from Anguilla, Antigua and Barbuda, Argentina, Aruba, Barbados, Bolivia, Brazil, Cape Green, and Chile, Colombia, Costa Rica, Ecuador, Jordan, El Salvador, Spain, United States, France, Philippines, Honduras, Mexico, and other countries that we have here. We wanted to just extend a warm welcome, a hug, and a goodbye. Thank you, everyone. We're at your service. Ciao.